Thank you very much, Sanya. We really appreciated you taking time out to give this closing address at our summit. Your hard-won experience in campaigning for the DG's position provides you with a wealth of knowledge that we are going to call upon over the coming months and years. And I'm also rather envious of the number of air miles you must have earned in this task. But thank you very much. We are now going to have some short keynote statements from some of the key players. We could not include everybody. And Samira Asma from the Center for Disease Control and Prevention.
It's been a very exciting 2 days. At CDC, we have prioritized accelerated implementation of the Global Hearts Initiative. And as we move forward, I think we ought to prioritize actions that could make a substantial impact from the discourse we have had over the last day and a half. A few points that I would like to make from CDC's perspective as we work with WHO and partners. Despite the improvements in treatment, low-cost medications, we know that only 14% of people worldwide have controlled blood pressure. Scaling up effective treatment for high blood pressure rapidly and substantially reduces risk of stroke, heart attacks, kidney damage, and many other health outcomes. So as we all think of prioritizing key actions, I think we may need to ponder. And as we all work together to implement the various elements of the Global Hearts Initiative, it will be critically important to evaluate progress relative to potential rather than past experience. Let me share what I mean by that. Is, for example, if we increase blood pressure control rates in the US to 70%, more than 11 million adults would have their blood pressure controlled. Or as Salim mentioned yesterday, 3 simple actions that could reduce CVD by 75% and which could save 2 billion lives is by taking action around tobacco, LDL, and blood pressure. So with these priority thoughts and actions, we look forward to continue working with you. Thank you.
Thank you very much, Samira. Now it's my pleasure to introduce Werner Hackel from the World Stroke Organization. I think personally it was a great privilege to meet with you for the first time. So thank you, Werner.
I've learned a lot, and I thought I'd give you a little bit of background information about the subject of stroke, because most of you are very much involved with the area of cardiac vascular heart disease. You think of stroke as one of the components within cardiovascular, which is correct. Stroke and cardiovascular disease are close relatives. We are no twins. And stroke is not the little sister, I must say. Stroke is a very important and large contributor. A few data. About 10 million new strokes per year. Stroke is #1 cause of mortality in China, in India, in Russia, and in Brazil. Stroke is more frequent in many countries than acute myocardial infarction nowadays. That is also something that not many people know. Stroke is treatable and preventable. And when we look at the world map for mortality and for incidence, that looks like a world map of gross national product. It is simply about financial resources. But when you look at the prevalence map, it's the other way around. While in the poor countries, stroke is a malignant disease with up to 40 to 50% one-year mortality. And that does not allow a lot of prevalence if you have this high death rate. In many other countries, we have a 15 to 20% stroke mortality, leading to a huge prevalence of stroke. We have not talked about that here, but the prevalence of stroke is certainly also one of the reasons why stroke is such an expensive disease, because many of those who survive their stroke have a handicap and need support, and this support doesn't come for free. And Salim, you're absolutely right. We can halve the mortality of, at least of stroke, with very, very simple measures. This does not depend on thrombectomy centers. This does not depend on the availability of CT scanning everywhere in the world. It simply depends on basic stroke care, of which most parts can be delivered by allied health professionals and nurses. It can be done. It has been shown that it can be done. We have examples from Vietnam. We have examples from Thailand. We have wonderful examples from Brazil and Chile, where they succeeded in building up a stroke system, and they are getting results that are absolutely comparable to what we get in North America, Western Europe, or Australasia. So this is what I wanted to tell you, and this is why I feel it's really important that we work together. We are ready to join you for any further occasion of this group, and I hope you find our contribution a little helpful. Thank you very much.
Thank you very much, Werner. Let me invite Etienne Krug to the platform to speak on behalf of the World Health Organization.
Good afternoon again, dear colleagues and friends. It's been a fantastic meeting, I would say. And when comparing to the Mexico conference just a year ago, it's amazing to see how, as a group, we have matured and how the dialogue, I think, is much more concrete and constructive than it was just a year ago. And I think a lot of tribute for that goes back to you, David, for your leadership and vision on this meeting. So thanks for that. I'm really happy with how far we got in these 2 days. We were here to think about what we can do more and better to raise the attention and action to tackle CVD. And when you think about which issues, how they rise on the global agenda, there's a number of factors needed. Usually we think immediately it needs to be a big problem. But clearly that's not enough. Here we're talking about the #1 cause of death, and we've been saying that for years, and it hasn't resulted in more attention. The second point is we need a big problem, but we need also solutions to tackle it. Again, here we have them, and they were endorsed even by the World Health Assembly just a few weeks ago in the Appendix 3, or the best buys to tackle NCDs. Again, big problem, solutions, not enough. We need a unified community, and that's what we've been working on in the last 2 days, and I think we got much closer to that in those 2 days, and I look forward to work with all of you in consolidating that even more in the months ahead. Then we need simple, clear messages. Again, we've been talking about that, and I think the session just before this one showed that we're not fully there yet. There were great ideas, but and they all made sense, I think. But we're not clear yet on which ones we should pick and why, and more reflection is needed, and I suggest we quickly think about the process of how we can continue that dialogue in the coming weeks to get to some kind of agreement on that. And hopefully then also resources will flow, which is one of the other important ingredients which is lacking. So I think the other point we haven't talked about enough maybe this time, and I want to throw it out before I leave, is that we shouldn't finish these meetings with a long laundry list of requests for governments and private sector and civil society and academics. We've been doing that for years, and usually they get just repeated at the next meeting and not so much happens in between. I think we should much more try to put on the table what we as a community can contribute. And as Sanja said, we have a very powerful group of agencies and people here in the room, and if we all put something on the table, that will be a lot. So I certainly want to commit WHO to do more. I agree with everything Sanja has said, including the criticism towards WHO's leadership. We haven't done enough in WHO to lead on NCDs in general and on CVD. We have done a number of things, but certainly not enough, and I commit certainly WHO to do more. For us, the priority will be the implementation of Global Hearts. We see that as a very important step because it aims at developing those success stories that we've talked about. It aims really at getting people with hypertension, with risk of CVD on treatment, particularly at the primary healthcare level, and to strengthen efforts on prevention, particularly on tobacco and on salt. And I think uniting behind Global Heart is certainly something this group should be considering more. A lot of you are already on board and have helped develop it and implement it, but I think there's room for many more of you, so I'd like to invite you also to consider that as one of the options for this coalition to move forward. Because if we get those success stories, we will have a very strong argument for see them spreading over the coming years. So thanks very much to all, and we look forward to work with you more in the coming months.
Thank you very much, Etienne. And now it's my pleasure to introduce David Stewart from the ICN, the International Council of Nurses.
Thank you. It is a wonderful opportunity to be here and to present and give my opportunity to discuss what ICN is doing. ICN commenced in 1899, so before the computers, before the telephone, and they communicated even before messages tapping their little buttons, whatever that may be, I've forgotten right now. In 1899, they got 20 countries together to look at the professional practice of nursing and the social determinants of health, and made some of the biggest strides in nursing in 1899. We have some of the most amazing forms of communication today, but have we got communication overload? We have so many needs pressing on us. Which one gets prioritised? The ICN today has over 130 countries that are involved in its work. We have 7 million members out of 16, actually it's 8 million members out of the 16 million nurses worldwide. But how do we prioritise the message of cardiovascular disease or NCDs amongst all of those different countries with all of their competing interests? And we do struggle with getting that message across. But we, with all of our resources and abilities, should be able to communicate this message more effectively. We are doing that within the ICN, and we have committed to working and developing strategies about what we as an organisation will be doing about this particular issue. One of the things that can easily be lost in some of these conversations is that it is somebody else's problem. The way that we are trying to change that conversation is, what can I do about this? Or how can I be involved, starting that social movement amongst nurses? We do seek to empower, we do seek to optimise the work of the workforce, and we do seek to develop the workforce. But what we do have is a workforce that is not fully equipped with the information. We do need to develop and empower and educate the workforce, and I loved what my colleagues have presented down there in setting standards for the workforce, getting the messages out there, developing continuing education programs, developing postgraduate education programs. If you mobilise and optimise this workforce that spends the greatest amount of time with the patient, with the families, is one of the professions that mostly deals with the determinants of health, we can make big changes. If we can involve the patient and improve health literacy, we can empower a social movement change so that it is not just a top-down approach, but we are mobilising a profession to use all that it can. And that is what we, I guess, is some of the actions that we are committed to doing, is supporting our members into doing that. And that is the actions that we will be putting forward in terms of our strategies, working on education. So we do value the idea of working as a global alliance, understanding that there is one message, one role, one message and one thing that we should be communicating. But we would also understand that there are different roles that we all need to undertake and work with our strengths. And we are committed to working with you on that as well. So in conclusion, I think, you know, we have said all of these things about tobacco control and all of these wonderful ideas and things that can demonstrate success. As part of the ICN, we would love to make sure that these messages are communicated effectively in a simple, concise and effective way to our members, so that all of a sudden it is not just a few, it is a global community in 130 different countries around the world. So I'd like to thank you for this opportunity. It has been fantastic and it's an outstanding opportunity to progress the work of nursing. So thank you very much.
Thank you very much, David. It is my duty now to bring the summit to a close, and if you will allow me to make a few concluding remarks about what we have learnt here and where we might next go on this journey. And we have created here a leadership forum for all of the professional organizations with a stake in circulatory health. You just need to look down the list of delegates, the organizations that have been invited and have come to this summit, to get some sense of the breadth of engagement in the circulatory world. And this journey began under Salim Yusuf's leadership when we first decided to reach out beyond the cardiology community to others working in circulatory health, and held an exploratory meeting at the European Society of Cardiology. Professor Fausto Pinto was the president at the time, and that gave us the courage to organize what we called the first summit on circulatory health in Mexico in June last year. Why circulatory? Because we called it cardiovascular, but our friends in the stroke world said that does not include stroke, and we finally settled after a day's negotiation on circulatory. But maybe we have to change our language again. Why bring this community together? Because we share a common objective, namely 25 by 25 or 30 by 30 or 50 by 50. I very much like Salim's reduce cardiovascular disease mortality by half in a generation. 50 by 50, I will be 101 years old. And if we are to accelerate our individual efforts as independent organizations to reduce the burden of circulatory disease, it would be more effective to do so together. It is obviously so. It would be more effective to do so together. And the question is, what actions can we take together? The question I posed at the beginning of the summit, to accelerate our collective efforts to reduce the burden of heart attacks and strokes. And I think my answer to that question is that we have the beginnings of a coalition here of all of these stakeholders in circulatory health who have not, as far as I know, come together in any other forum with a shared ambition of 25 by 25 and with enormous opportunity to do work together to accelerate our efforts to reduce the burden of disease. And what do I mean by a coalition? I am thinking about a virtual roundtable at which everybody has a seat. So every organization is represented there, and we meet in this forum, this summit, which we convene on an annual basis to assess our progress and to agree on new actions that we can take together. And what should those actions be? Well, I would focus, and others are welcome to suggest other approaches, but I would focus on, firstly, advocacy. We should advocate together. And of course, we have to have a clear idea of what we are advocating for, and we will work together to that end. But advocacy by so many voices around this room makes us very powerful. I think Sanya is right. This is an enormously powerful community, and we need to harness that power at a continental and a national level through each of our organizations. And secondly, I think we need to communicate together. We have to speak with one voice. We have to have common messaging. And if we were able to achieve those two things, if we were able to advocate together, and if we were able to communicate together, I think we could advance this agenda at much greater speed. We have to be clear on what our actions are going to be in the context of advocacy and communication, and WHO has put before us global hearts as something that we can all contribute to, prevention and control of cardiovascular disease, which fits within each of our disciplines, but there are others to be considered as well. I am very attracted by the concept of protecting the hearts and minds of children and young people. It has a political aspect to it, which is very powerful, and it also has also provides us with the opportunity to challenge industry in a way that we are not so successful in challenging industry for adult diseases, but to be considered. So the next steps will be for the steering group that put together the summit program to distill the conversations over the last 48 hours and to come back to you, the leaders of your respective organizations, with a proposal around creating a coalition together, around advocacy and communication, and maybe some other ideas as well, and to focus down on one or two or three clear actions that we could take together. It has been an absolutely unique experience, at least for me, a meeting of leaders from all over the world sharing a common vision for circulatory health. So let's draw on this inspiration and act together to save hearts and minds. Thank you very much.
Thank you very much for getting close to the end. Thank you, all of you, for coming here, for joining us in Singapore. I think it was a wonderful event and wonderful 2 days, and as it was said, a lot of knowledge exchange, networking, and opportunities to share experience. We'll make sure from WH's perspective to keep the link with you, keep the ball rolling. We definitely want to keep the contact, talking about communication, about virtual networks. That's all tools we'd like to implement in the coming weeks and the coming months to keep this community alive. I'd like to thank a few persons specifically. First, our host in Singapore, Vernon Kang from the Singapore Heart Foundation, Jack Tan from the Singapore Cardiac Society. I'd like to thank the Asian Pacific Society of Cardiology, the Asian Pacific Heart Network, and the Asian Federation of Cardiology. I'd like again to acknowledge the generous support of our partners and sponsors, Amgen, AstraZeneca, Novartis, Pfizer, and MCI. I'd like to thank the staff at Suntech, the audio people, video and camera, also John and Samantha. I'd like to thank my team. Not the first Congress for organizing together, or first event organizing together. I've heard very good things about you. You made these 2 days smooth running and interactive. So thank you very much for the program and the content. Well, for the program and the content, I'd like to thank Jeremiah, Johanna, Alistair, Lindsay. Lindsay is getting married, so she can't join us today. Pablo, and for the organization, Jennifer, Andrea, Lena, George, and Rachel for the communication. So thank you very much appreciate it. And finally, I think we should all like to thank someone who has been behind this summit. I think he's been in contact with most of you. He's been working days and nights, pushing for a maximum of participants, pushing to have hot topics, pushing to have panelists. And as you know, that's David Wood. So let's stand up once more for David. Thank you. And I wish you all a safe journey back home. Thank you very much. And don't forget to put your name on the panel before leaving. Thank you again.